Hello, welcome to our webpage. This is Premier Health Florida. I'm Dr. Christopher Burnham, and I'm going to talk to you today a little bit about what we do here that's different in other chiropractic offices. In our office, we believe that finding the root of the problem is necessary in order to correct it. Now, if you have an acute injury, we're obviously going to be looking for sprain strain type injuries, muscle spasms, ligament stretching, muscle stretching, damage to the joints locally and the nerves. But however, for that to heal properly, we want to check the skeleton and the structural support underneath of that tissue to make sure that it won't cause a problem with the healing of the issue. For example, if you have a scoliosis, a curvature in your spine, and you have a full scoliosis in your spine where your spine is curved, it's going to impair your ability to heal that area. It's not going to heal correctly, and it can lead to chronic pain down the road. Now, some people may not know that they have scoliosis, but most people who have scoliosis know. But what happens is a lot of people have a slightly less than a scoliosis curvature, like maybe 8 degrees or 6 degrees, which will impair your ability to heal, but it won't necessarily be diagnosed as a scoliosis. Now, in our office, what we'll do is we'll evaluate what's causing this curvature. There are many things that can cause a curvature like that. One of the things that can cause that is a difference in the length of the legs. As you can see right here, if one leg is slightly shorter than the other one, it grew at a different rate. It was damaged when you were a child, or you had an arch in your foot that fell. It'll cause your pelvis to be off balance. When your pelvis is off balance, it'll cause the body to compensate with a curvature like this. Now, there's no adjustment, there's no surgery, there's no pill you can do to correct that issue. What you have to do is you have to come to a professional who's certified in their field and can actually treat this condition, is familiar with it. And what we'll do in this office is we'll fit you for a heel lift to balance it out. We'll do some manipulations with an instrument. We use an electric adjusting instrument here to loosen up the joints, get the joints moving freely like they're supposed to. And then we'll do some traction to stretch out the joints where it's compressed to restore motion to the joints and the disc. And then we'll start some exercises to actually correct the issue while we fit you for a heel lift, and we can actually straighten out your curvature like this. Now, not everybody has a curvature like that. There's different things that can happen, but in this office, you may have a shoulder issue. You may have a rotator cuff issue where the rotator cuff has been slightly torn or completely torn. We can actually help stabilize the muscles around it despite the weakness of the ligaments, and stabilize the joint enough that most people don't have to have surgery for it when they treat in our office. Now, we don't just do shoulders, knees, but we also do hips, TMJ. If somebody has a TMJ that's locking up and it's interfering with their ability to chew or causing headaches, headaches is another good thing. But most of what we see in this office is disc injuries. When you have a disc injury, either from a chronic whiplash or a recent whiplash or a slip and fall, you have a disc here that's surrounded by tough layers of cartilage with gelatin on the inside. And when that disc is damaged on the outside here, you can see there's some lines you might not be able to see on the video, but there's some tearing of this disc here. It allows the disc center to push outwards and either cause a bulge or a herniation. As you can see, it's pushing towards this nerve right here. And there's no pain usually until it actually hits the nerve. Then once it hits the nerve, it causes pain. But what we do is we do traction to create a pressure on the outside of the disc here that pushes the disc inside, and it pulls the pressure off. Now, it won't stay like that. It won't fix it just by putting it back in place. You actually have to do some exercises to stabilize and strengthen this, just like we were talking about earlier with the curvature. It can curve to the side, but you can also have a weak curvature from front to back. In the lower back here, this shows a disc that slid out of place and a bone that's spasmed, and the muscles are holding the bone in that position. What we do in this office is we'll do a manipulation with an instrument that vibrates the joint very gently to loosen it up. It vibrates back and forth, and it loosens it up. It decreases the pressure on the nerve. It decreases the stimulation of the nerve and decreases the muscle spasms in the area. It loosens it up, and then it allows it to slide into place. Then we do some therapy, some cold laser, some traction on it to help it feel good. And then we do the traction get it to stay loose, mobilize the joint, get range of motion there. And then we solidify everything into the new position with a follow-up of exercises. We teach you exercises here that you can do on your own at home, and they're very simple to begin with, and we build up intensity gradually over time. Now, if you have any specific conditions or specific questions on what we do here, you can feel free to give the office a call. It's 904-503-2745. And feel free to join us on our Facebook page. It's Premier Health Florida. You can post questions on there and we'll answer them for you. And if you have any insurance questions, you can always ask ahead. Call the office. We'll verify your insurance for you. We'll work with all insurance companies and we'll verify your benefits for you. We also offer fabulous Chiro Health USA. It allows you to get discounted rates on your treatment if you don't have any insurance, or if your insurance has a ridiculous overhead or a deductible or a copayment that's just simply higher than the cost of a cash patient. We can work with you. But we do accept auto accidents. We'll work with your attorney and co-manage your case with your MD. If you have any questions, please give a call to the office, 904-503-2745. And go ahead.